Let's go over some information on the human body. So more specifically, we're going to get into body systems. So the importance of knowing these body systems, it'll help you assess the victim. So it kind of gives you an understanding of what's going on and why you're doing the skill the way you're doing it. And it helps you also understand why time is essential. So which of these body systems are going to be damaged if they go too long without oxygen? That's really the key. How long can some organs go without oxygen? And especially if we're dealing with the brain, we know that the average person can only go 4 to 6 minutes without oxygen. So just knowing that helps you understand why, if somebody stops breathing or their heart's no longer pumping, why these skills are so important. And it also gives you information you can pass along to 911. So we're not going to hit all the major body systems or all the body systems. We're just going to hit the big three. So that's respiratory, circulatory, and nervous. And the reason we focus on these body systems as opposed to all the other ones is that if these systems shut down, all other systems will shut down. So if the respiratory center is shut down, obviously you can't get oxygen to the blood to be pumped around to the rest of the body systems. So all other systems will shut down. If the circulatory system shuts down, either because the heart quit pumping or the blood vessels got damaged in some way that either you can't pump the blood around because you're losing it, or there's just not enough blood to go around, then all other systems will shut down. If the nervous system gets damaged high enough, so on the central nervous system, if we're talking about the CNS, if you get damaged high enough, around C1, C2, anywhere in the cervical region, you can shut down all other body systems, either because you got put into neurogenic shock or you shut down respiration. So that's why these big three are important, because if you understand them, you understand why skills are designed the way they are. And it's really just to buy the victim time. So respiratory center, if it fails, just like I mentioned earlier, all other systems will fail because you can't get oxygen to the tissue. If there's no oxygen available to the brain tissue is going to die fairly fast. And it's really not, it is important to eliminate CO2 from the body, but the big deal is not enough oxygen getting to the tissues, especially the brain. So watch this video on the rescue position and answer the question in your lecture notes. So common respiratory emergencies are drowning, choking. Choking is probably one of the biggest. Smothering, which you see in infants more so than any other population. Crushing injuries that you may see in a car crash. Inflammation, so allergic reaction or asthma. Any of those can cause inflammation to the airways. And the most common cause of a cardiac emergency is a breathing related emergency. And we're going to have specific questions in this class, and there are skills that are specific to that when you get to infant and children, and we'll talk about that further once we get closer to that specific skill. So drowning, let's talk a little bit about that. So if a person drowns and they get water into their airway, it's important that they seek medical attention afterwards. If they survive, let's say you've got all the water out of their lungs, you perform CPR, what have you. Let's say they didn't have a pulse, you performed CPR, you brought them back around, you got the water out of their lungs. It's important that they go to the hospital, even if they feel fine afterwards, because you can have what's called secondary drowning. So if they drown and get water into their lungs, it can wash off this coating that's on the inside of the lungs, this surfactant, and then fluid can build up. It's a pneumonia-like condition that can result in them dying afterwards. Some victims that are perfectly fine after they've been brought back around after they've been resuscitated, end up dying 24 to 48 hours because they didn't go seek medical care and fluid built up in their lungs and they died from it. So I just wanted to mention that in case we don't talk about it in future slides or future lectures. So crushing injuries, you see that a lot in car accidents. Somebody hits the steering wheel, damages the airway, punctures a lung, what have you. Can lead to a respiratory emergency. And obviously choking, conscious choking, unconscious choking. We'll get to that when we talk about CPR because those skills are related. Especially the unconscious choking skills are related. And we'll talk about that more. But we got to obviously get that airway open so the person can breathe and have exchange of air back and forth so they can oxygenate their blood. Signs of respiratory problems: abnormal breathing rate, so they're breathing really fast. Pale or bluish skin is an indication of poor perfusion, meaning that they're not getting enough oxygen out to the tissue, or mainly because they're not oxygenating the blood because they're having a respiratory problem. Nasals flaring. Calm, clammy skin, again, poor circulation. It's not necessarily that the blood's not getting there, it's just not oxygenated. And then you have differences between respiratory distress and arrest. Distress is they're having problems breathing, like with asthma, or maybe partial blockage of the airway, but there's still airflow. There's air exchange. Respiratory arrest, completely stopped. So it's been blocked off. So maybe somebody choked on something, completely blocked the airway. That's respiratory arrest. Or they drown. That would shut down respiration as well if they had too much water in their lungs. Conscious versus unconscious choking. So watch this video. This is actually conscious choking that leads to unconscious choking. But watch the video, answer the question in your lecture notes. Circulatory system. If it fails, all other systems will fail. You have what's called the perfusion triangle. Don't get bogged down in these terms. Just understand that each corner of a triangle, so let's say blood's at one, the heart's at the other, and then the blood vessels make up a triangle. If there's not enough blood to pump around, circulatory system is going to fail. Either external bleeding, internal bleeding, maybe severe burns where you lost a lot of fluid, but there's not enough blood content to be pumped around, circulatory system will fail. Or maybe somebody has a heart attack. If the pump is not pumping, the blood can't be pumped around to the tissue, and that will cause the circulatory system to shut down, and then eventually all other systems will shut down. If the blood vessels, now this is going to be a common theme when we get to shock. Remember this term, vasodilation, because you're going to hear it a bunch when we talk about shock. So what can happen is vessels expand, either because they were damaged or there's no neural impulse to them, but the vessels just relax and open up. So if your arteries get too large, there's not enough blood that can fill them up, and blood pressure will drop off. Blood pressure is extremely important when we talk about the circulatory system. If it gets too low, you can go into shock, and that can cause the circulatory system fail, and then all other systems will fail. That's why I have the example there of shock. We'll talk about that. We'll have a whole lecture on different forms of shock. Blood. So red blood cells deliver oxygen. So I give you the example of Lance Armstrong, and he was taking EPO, erythropoietin, which increases red blood cells. Before this drug got out into the exercise world, people were blood doping, where they took out red blood cells, took out blood, concentrated red blood cells, and injected it back in. So they had a doctor that would do that for them, gave them more oxygen carrying capacity. So for aerobic events like cycling, it helped them do better. And that's the reason Lance Armstrong was able to outperform everybody, is because he was taking EPO, which was eventually developed for cancer patients to increase red blood cells, because chemotherapy will kill off red blood cells and the people were getting weak. So EPO increases red blood cell concentration and makes you more of an aerobic powerhouse as long as you're not sick and undergoing chemotherapy. and that's how he's able to outperform it. The reason that I mention that is so that you can see the importance of red blood cells delivering oxygen to the tissue. Plasma is the fluid content of the blood. It delivers nutrients to cells. It also picks up waste products to get it out to the lungs and kidneys so you can excrete that waste and get it out of your body. Plasma is 90% water, so when you get dehydrated, your blood becomes viscous. That's why I have an example of blood viscosity. So let's say you don't drink enough water, your plasma concentration will go down in the blood. Red blood cells will start to kind of clump together. Not enough oxygen will get to the tissue, so when you get dehydrated, that's the reason you get headaches. It's because you're not getting enough oxygen to the brain cells because the blood is so viscous and thick. You're having a hard time getting those red blood cells down those capillaries. You can have some capillaries that are so small that only one red blood cell at a time can fit down them. There's only enough space for one red blood cell. So if your blood starts to get really thick and red blood cells clump together, they may not get to the place they need to go. And it can be dangerous when we start talking about ischemic stroke, really more important when we start talking about TIAs, transient ischemic attacks. We'll get to that in sudden illness on how it can help clotting occur if you're dehydrated, or it can increase the chances of it. So anyway, hypovolemic shock is when you're losing too much blood either internally or externally. That can lead to shock, or the cardiovascular system shutting down. So that's another example of the cardiovascular system having problems because of blood content not being there. Perfusion, how well is the blood being circulated through the body? So hypoperfusion means it's too low. You're not getting enough blood supply to those areas. So the average amount of blood in an average adult would be 10 to 12 pints. So a water bottle is roughly about a pint, pretty close, about 2 cups. So you have about 24 cups in the body, if you want to look at it like that, or 10 to 12 pints, or 5 to 6 quarts. If anybody changes their oil, that's about the amount of oil that would be in a V6, 5 to 6 quarts of oil. So, or quarts and liters are real close. They're not exact, but you can look at it that way too. So you've probably seen those liter size Gatorade bottles. So about 5 to 6 of those, roughly. Just giving you a visual of how much blood is in your body. It's not as much as you think. And if you sever a major artery, you can bleed out really quick. Like if you cut the femoral artery, it doesn't take long to dump out a lot of blood and to go into shock. So 1 quart, just 1 quart can put an adult, 1 quart loss of blood can put an adult into shock. So heart, if the heart fails, you shut down the cardiovascular system. So it's the pump. You have the atria, the ventricles, electrical system. We'll talk about the electrical system when we get to AEDs. So SA node firing to the AV node. There's a little pause between those, and then that fires out to the Purkinje fibers actually cause the ventricles to contract. But think of the SA nodes as causing the atria to contract, the AV nodes as a little relay station that causes the ventricles to contract if you're into electrical work. Path of blood flow. So don't get bogged down into this. This is just showing you the path of blood flow through the body. But it is important to understand how the heart works. So here we can see, let's just look at the vena cava. So you have the superior vena cava, inferior vena cava. Blood returning here to the right atrium, drops down to the right ventricle. The heart contracts. Blood goes out to the lungs. The lungs oxygenate the blood. Comes back in here to the left atria, down to the left ventricle. Left ventricle contracts and pumps it out to the rest of the body. That's the reason if you do a lot of aerobic work, this left ventricle will grow and get larger. the filling capacity of the heart also increases. So your stroke volume, cardiac output, all of that can go up if you exercise. Exercise is extremely important in heart health. All right, blood vessels. You have arteries. Arteries are what take blood away to the tissue. Oxygenated blood, I should say. So this red here, those are arteries. And that's taking blood out to the rest of the tissues once it's oxygenated in the lungs. This is one of the few arteries here. Well, I guess it's leaving the lung and going to the heart, but it's one of the few that's not leaving directly from the heart itself. So the red indicates arteries and oxygenated blood. The blue here indicates veins, or the venous side, deoxygenated blood. And then you have capillaries, which are kind of like that connection here between arteries and veins, where nutrients and oxygen get dumped off, even at by the plasma and the oxygen being dumped off by the red blood cells. And here we pick up waste products, and deoxygenated blood returns back to the heart, so it can eventually get to the lungs and be oxygenated again. Just wanted to give you a visual. And again, you'll hear this term vasodilation a lot when we start talking about shock. And then you have vasoconstriction. That's where vessels actually constrict and get tighter. That happens a lot of times when they're severed. So the pulse, you have different areas for a pulse, and this is important, especially when you're checking somebody for signs of life. Checking a pulse is extremely important. So carotid is up in between the Adam's apple, sternocleidomastoid muscle. You can find the carotid artery. Femoral artery is down in your leg. It's kind of hard to find. We don't use that one too much in first aid. We'll use carotid. Radial is between the radius bones and those tendons. And you can look all these up on YouTube on how to find these. And brachial, you'll normally use that on the infant, so right on the inside of the arm, pretty close to where, well, it is where you would put a blood pressure cuff on, because that's what you're listening to when you take blood pressure. So carotid, extremely important. That's normally where we're going to take adult pulse. We're going to find out their pulse from there. A radial, you normally use that when exercising, but you can also use that checking for signs of life. And you're using the pad of 2 fingers. Don't use your thumb. Your thumb actually has a pulse in it. And then brachial. And brachial is normally used for infants. You can use it for an adult, but it's normally used for infants. Posterior tibial is just on that knob on the inside of your ankle. You can find it just behind that knob there. And dorsalis pedis, only 20% of the population can you actually find this right on the top part of your instep. Hard to find, but the big 3 that I want you to know is carotid, radial, and brachial. Look those up on YouTube. They'll show you how to do them, or you can just Google it and it'll show you where they're at and how to check them. Blood pressure. So that's the pressure on the walls of the artery. So let's look at the different types of blood pressure, or you're measuring systolic and diastolic. So systolic would be the pressure on the arterial walls when the heart contracts, and diastolic is the pressure on the arterial walls when the heart relaxes and fills back up with blood. So an example of systolic would be this 130 here, would be systolic pressure. That's the pressure on the arterial walls when the heart contracts and pumps out blood to the rest of the body. This bottom number here is the pressure on the arterial walls when the heart relaxes and fills back up with blood. This is extremely important, blood pressure, when you're trying to determine if somebody's going into shock. For a lay person, you more than likely won't have this in a first aid kit, but it is good to understand how it's used and how it can be used to determine what's happening to the cardiovascular system. Now, for overall health benefits, 120/80 would be average blood pressure. They have actually lowered the numbers for hypertensive. So now it's 130 over 80. It used to be 140 over 90. So anything over 130 over 80 is now considered hypertensive. So average male blood pressure tends to be about 120 over 80. Average for a female tends to be 110 over 70. You need to start kind of monitoring your blood pressure anytime it gets over 120 over 80. Start talking with your doctor and trying to determine what's going on, what's changing it. All right, anyway, this is important, especially when we start talking about shock. If your blood pressure gets too low, you could go into shock. Nervous system. So once the CNS is damaged, it doesn't regenerate. So there is limited nerve repair in the peripheral nervous system. So as long as the nerve cell body is intact, there can be repair. It won't be, once damage has happened, that damage is always going to be there, but there can be some repair. And let's go down real quick to the central nervous system and the different parts of it. So the central nervous system, the occipital lobe controls sight, so that's right at the base of the brain. The frontal lobe is out in the front. Behavior, so if you may have heard of Phineas Gage. He had a rod blasted through his head. Before that, he's a super nice guy. After that, his behavior changed. And it has a lot to do with memory as well, but that's how they found out that the frontal lobe controlled behavior. The temporal lobe is smell and hearing. And you also have the hippocampus is over there. And the hippocampus is near the temporal lobe. Has a lot to do with memory, taking short-term memory to long-term memory. So the person may still have their short-term memory if the hippocampus is damaged, but may not be able to take those memories into long-term memory. And then parietal lobe, spatial reasoning. So that's right at the kind of top part in between the frontal lobe and the occipital lobe. You'll have the parietal lobe. And then you also have the spinal cord. That's also part of the central nervous system. And if that's damaged, a lot of time it won't repair itself. So once it's damaged, it's damaged. So here's the different parts of the spinal cord. You have cervical, so C1 through C7. You have thoracic, T1 through T12. And you have lumbar, L1 through L5. So if you have damage around C1, C2, that can actually shut down respiration. It can cause all the vessels in your body to expand, and so your blood pressure drops and you can die because blood's not being pumped around. But you could also die because you're not breathing. Thoracic, any damage to the thoracic area, you could lose sensation below that area. Damage to the lumbar regions, so like somebody that's paralyzed below the waist, it's probably damage to the central nervous system in between L1 and L5, and you have the sacrum and then your tailbone. So I just wanted you to have a good understanding of the different parts, how they affect other body systems, and how the respiratory centers, if those shut down, all other systems will shut down. If the circulatory system shuts down, all other systems shut down. And if you have damage to the nervous system high enough, all other systems can shut down. Understanding these key components, how they work, really will help you understand how to assess a victim and what's going on, and information that you can relay to 911. It also helps you understand why you're doing a certain skill and what skills should be done based on what you see and during your assessment of the victim.